Welcome to the I Am One podcast, where we talk to perinatal mental health advocates, professionals, and educators supporting the mission of Postpartum Support International. We're not afraid to ask our guests about the hardest parts of pregnancy and postpartum because we know that PSI has tools and resources to help in every situation, and everyone should know about them.
Whether you are among the 1 in 5 moms, 1 in 10 dads, one of many trans or non-binary parents, or you're one professional or advocate committed to helping folks in need, you are also one of us.
I'm your host, Danny Giddens, and I am 1 in 5. I didn't know what to call what I was experiencing after becoming a parent and felt too scared at the time to speak up.
Not anymore. Now she won't stop talking about it. Hi, I'm your co-host, Emily Jankowski. I'm also 1 in 5, and I want you to know that mental health complications are common, but they aren't normal.
There's something powerful in knowing I am one of many. Whether you're already connected to the perinatal mental health world, looking for new ways to support parents and families, or just want to hang out with us in your earbuds, we are so glad that you tuned in.
Of course they want to hang out with us. We're lovely. Seriously, though, the views, thoughts, and opinions expressed on this pod are the speaker's own. Tuning into this podcast is, spoiler alert, not a replacement for therapy, but PSI can help you find a therapist. We could also help you find a psychiatrist, a support group, or Waldo.
Emily, Waldo? Come on! We don't know where Waldo is.
Okay, fine. PSI help seekers can find peer support and resources in their area.
At PSI, we want you to know you are not alone, you are not to blame, and with help, you will be well. On today's episode, we're sitting down with Rachell Dumas, a registered nurse, keynote speaker, and founder of A Light After 9, a nonprofit dedicated to supporting women and families navigating infertility and pregnancy loss. We'll chat about underserved populations, equity and compassionate care, and how Rachell transformed her personal adversity of 8 pregnancy losses and 1 stillbirth into a mission to empower others. When we heard about the incredible work she's doing to support families in the perinatal period, we didn't walk. We ran to the podcast studio. Fair warning, today's episode includes giggles, lots of tears, and more laughter. It was an absolute pleasure to record this story and an honor to share it with you now. So without any further ado, please sit back, relax, and enjoy this episode with our friend Rachell. Rachell, welcome to the podcast studio. We are so excited to be sitting here and being real giggly with you this morning. We're going to get serious. We're professionals here. We've done this before. We're so excited to have you here and to hear some of your lived experience and to hear about all the incredible stuff that you're doing to support folks in the perinatal period today. So excited for people to hear about the nonprofit that you founded, but I'm not going to give it all away right now. Jeez, what am I doing? Sorry.
Save it for later.
So welcome. Thanks for being here.
Thanks for having me. You guys are hilarious. I'm just happy to be here, and you guys have made this podcast amazing already. So thank you.
Aww.
Thank you. I think it's such an honor to be able to hear other people's stories and be trusted with whatever you choose to share with us. So we try to bring a little bit of joy to that.
Yeah, you do.
Sometimes it's in the form of, making fun of me when I had to assemble my microphone.
Yeah, for everybody listening. I mean, I think before we get to the serious stuff, Rachell and I were hanging out in the podcast studio. Emily joins, and she is trying to screw her microphone into the arm. And I was like, I'm so sorry you have to see this, Rachell.
I was not prepared for class. It's like I left my pencils at home,
Yeah, it's okay. So I think, Rachell, let's just hop right in. Could you give us a little bit of an introduction to who you are?
Yeah, so I'm Rachell. I'm a registered nurse. I'm also a maternal health advocate and an entrepreneur. And I started my nonprofit A Light After 9 after my very traumatic pregnancy journey. And I am trying my best, my absolute best, to make sure no birther, mom, and their support system ever goes through anything that I've been through, if possible. So here I am.
Yeah, we're excited to hear all about it.
Yeah, I'm excited to talk about it. I think we are going to talk about a lot of different topics that's very important and very difficult to talk about today. But we need to start the dialogue.
Yes. So with that, usually our first question is like, what role did perinatal mental health disorders play in your life? And I kind of want to go maybe a little bit earlier than that and ask, like, can you talk about the pregnancy conception journey? Because I think perinatal mental health disorders includes anything mental health related that occurs like while trying to conceive, after a loss, after pregnancy, during pregnancy, anywhere in that lengthy period of time.
Yes.
So can you take us to like the beginning of that for you?
Yes. So I was born 19. I'm just kidding.
It was a dark and stormy night.
It was actually a hot and humid night. I mean, day in New Orleans. It was during hurricane season.
Yes. Yeah. Mm-hmm. Hurricane season does bring the babies, that like low pressure system. And suddenly here we are, right?
Here we are. But yes. Back to the beginning. So my pregnancy journey started in 2018 where I got an at-home pregnancy test and I was bleeding. So I made an appointment with the OB just to see what was going on. He did a vaginal ultrasound and told me that I was having a miscarriage. So this is over a span of like 3 days where I found out I was pregnant and then I found out I was miscarrying.
That's a roller coaster.
Yes, it is. Because transparently, I wasn't trying, but I was so excited about it. I wasn't not trying either. So I was excited, and then I was like, oh, confused. He reassured me that I would go on to have a healthy pregnancy and I would have a baby and then everything would be okay because this is a normal part of the pregnancy journey. And being a nurse, a trauma nurse, and not a maternal health nurse, I was just like, okay, I guess it is. I don't know much about it. If the doctor, the OB is telling me that, that's what it is. I went on to live my life, got engaged, got married, went on vacations, concerts, and then the pandemic happened.
Super.
Yeah. And I was an ICU nurse while it happened, and I was a travel nurse, and my contract had just ended right before the pandemic, and I went to help out in New York because...
Oh, wow.
Oh, wow.
Like, literally, why not?
Right.
Wow.
I got sick with COVID, and I was fighting for my life in a hospital room, going between a hospital room and the ER, and I finally nursed myself back to health, and I got home back to Atlanta, and maybe a few weeks later, I found out I was pregnant while I was at work, and I was excited again, but then I wasn't excited because I was bleeding again. So I'm like, okay, what's going on? Let me go to the ER. The ER doctor does a vaginal ultrasound and tells me you're having twins. So now I'm excited, scared, and just flabbergasted because who is having twins?
You're like, I was not expecting this plot twist.
Right. This is a big plot twist, but okay, let's roll with it. I'm excited. We're pregnant. But I was bleeding and he said, follow up with the OB and everything looks fine though. Sometimes women bleed when they're pregnant. They'll figure out what's going on. Went to the OB, and she told me you might be having a subchorionic hemorrhage, which is when the baby is implanted. They pretty much dig into your uterus, and this can cause a miscarriage.
So does it implant too far?
It's not implanted too far. It just could irritate the uterus.
Oh, wow. Okay.
So it could get so big that it causes miscarriage, or it can just be reabsorbed by the body, which is usually what happens, and you just go on and have a healthy pregnancy. Unfortunately, my symptoms got worse. I started to bleed more. I had severe abdominal pain.
Wow.
It was bad. I was in and out of the ER and the OB's office every week, multiple times a week.
And is this like early in pregnancy? This is like a couple of weeks in and you're dealing with all of this. Oh my goodness.
Yes, I went to the ER at I was 6 weeks, all the way up till 13 weeks. My symptoms were horrible. And I kept getting ultrasounds and kept getting reassurance that the babies were fine. And then at 13 weeks, I lost the first baby.
Ugh.
I was sad, but hopeful because I still was pregnant. And then my symptoms resolved. So I'm like, okay, now I really am fine. Everything's fine.
Which can be normal. Like, I
Right.
mean, that first trimester for a lot of folks is like when the nausea and whatnot is what's happening. Yeah. Okay.
It was the severe abdominal pain that really scared me. It was severe 10 out of 10 pain.
Ugh.
I was rolling on the floor crying. And once I lost that first baby, everything went away. The bleeding, the pain, everything. I felt better and I was hopeful because I was still pregnant and the symptoms had resolved. So, maybe I was losing the baby. I don't know.
Right.
I got another ultrasound after that loss. Everything was fine. Baby was perfect. Genetic testing came back fine. I was comfortable enough to allow my friends to celebrate me. They threw a gender reveal. On Halloween, I was so excited. One of my favorite holidays.
Oh, Emily too.
Yes.
She's team Halloween.
Yes.
It's too scary for me.
Typical.
I love scary movies, but I love Halloween. So I got dressed up and stuff like that. That morning I woke up and I was wet. And I assumed I had urinated on myself because I didn't get the education that I would find out later that I should have gotten. So I cleaned my sheets. My friends came over to start decorating.
It wasn't blood, though.
No blood.
Oh, gosh.
Was it your water?
Yes.
Oh, no.
Yeah.
At 20 weeks?
This time I was 15 weeks.
Okay.
I was 15 weeks. So I went on throughout the day. I remember calling one of my friends and saying, this is going to be a bad day. I don't know what's going on, but it is. And she was trying to convince me to go to ER. But I was just like, no, I'm fine. I want to celebrate. I just urinate on myself, but something just feels off. But I can't explain that. I can't go to the ER and just be like, something is off.
Right.
But the day went by and we were about to start the gender reveal. I had to use the bathroom. And I went to the bathroom and the baby fell out.
Are all of your friends and family literally there?
They're literally there. And I'm a very private person. I know I'm literally telling my business right now to you, but I'm a very private person and I like to grieve alone. And when I went out and I gathered myself, I just heard everybody screaming. And this is why I'm private. I heard people screaming, crying, and I couldn't focus on or even process what just had happened because it was scream over here, cry over here, question over here, question over here. You got to do this.
Too much.
Yeah, it was just too much.
Yeah.
I just everybody gotta, y'all gotta leave. Y'all gotta leave. Everybody gotta leave.
Right.
And I had to go to the ER,
Right.
And then I had this experience with a doctor. I came in, my husband had to leave. It's 2020, so he couldn't even stay. I had to go through this alone.
Oh, right, because this is October of 2020.
This is October of 2020.
Right. Okay.
Yeah.
Mm-hmm.
So he just rolled me in there and had to leave. They were strict, you have to go. And I'm just crying and, distraught. And the ER doc was like, what's going on? And I said, well, the baby just fell out of me in the toilet. I was 15 weeks pregnant. And she said, how do you know you were pregnant? I said, oh, do you want to see a picture? And she said, yes. I showed her a picture and she's like, oh, you were pregnant.
Oh, good. Glad we're on the same page.
Yeah. So that's just a big turning point in my pregnancy journey where I knew something was wrong with me. I knew in 2018 when that doctor said this would be a smooth journey, it was no longer that.
Yeah.
I knew it was going to be complicated. I knew this was about to be a fight.
Mm-hmm. Right. So at that point, you'd had 3 losses.
3 losses.
And you had a doctor who probably, given your age, your experience, was like, miscarriage does happen. This is your first one. How would you know that this was going to... But then you're in with this ER doctor and the ER doctor is like, show me the receipts to prove that you
Right.
were... what planet are we on?
Right. And the crazy thing is that's not even the worst experience that I've had,
I bet.
So I follow up with the OB and she diagnosed me with cervical insufficiency, which means my cervix is too weak to carry a baby. And once they get to a certain weight, usually in the second trimester or close to that, depending on how big the baby is, they would fall out essentially.
So knowing that, at what point do they... Because the treatment is like a cerclage, right?
Yes.
What's a cerclage?
A suture around the cervix to keep it closed. So even once the baby gets heavy enough, my cervix won't open up.
You're like stitching it closed, basically, right?
Mm-hmm. Yep.
Medicine is cool.
It is. But there's 2 types, right? There's a transabdominal and a transvaginal. The transvaginal you get at 13 weeks and you get it removed before you go into labor.
Oh, hello. Need an exit.
Right. And then you do a vaginal birth, ideally.
Right.
there's a transabdominal cerclage, which I had no clue about, and definitely would have chose this option, which is a permanent cerclage. And you just do a C-section, but it stays in there through all your pregnancies. You don't ever have to.
I've never even heard of this.
Exactly.
Wow.
So I had a couple of early miscarriages, talked to the doctor, make sure, she was aware. No one ever sent me to a specialist until I was at work, right? And I'm telling my supervisor about all of this. I'm off of work and she has to know why it doesn't work.
Yeah.
And she's like, let's talk to our OB on the team. And she's like, you need to see a specialist. Let's talk to a reproductive endocrinologist.
Yes.
Yeah.
And they found me one. And I saw the reproductive geneticist. Everything was fine. The endocrinologist was like, let's do this test, this test, this test. A hysteroscopy, make sure there's no inflammation surrounding your uterus that may be causing it. Make sure the shape of the uterus is fine. All these tests. Let's do all this blood work. She was very thorough, gave me hope. I was like, man, I should have been did this. And she's like, I'm going to follow you throughout the first trimester. The next time you get pregnant, and then we're going to order aspirin, make sure there's no clotting issue. We're going to do progesterone suppositories to make sure we strengthen the cervix and try to get you to that 13 weeks.
Right.
I was excited. I'm like, okay, I feel comfortable to try again. April 2021, I found out I was pregnant. She followed me, did the suppositories, did the aspirin, and she followed me every other week. She was on call, she was whatever you need. Made it to 13 weeks. Graduated to the maternal fetal medicine specialist.
Yeah.
To get the cerclage done. 13 weeks, got the cerclage done. And she was like, come back in 7 weeks.
And this is the transvaginal cerclage.
The transvaginal.
Okay, right.
My issue was, at this point, I had 5 losses. I didn't feel comfortable coming back 7 weeks later.
Yeah, because you were on the every other week plan until that point, right?
Yeah. So to go from that to, come back in 7 weeks, it's just like...
Like your instincts were like, no thank you.
Yeah. So I begged her, I was like, please let me come back before then. Please. She's like, no, if it fails, you'll have excruciating pain and bleeding. I'm like, well, I guess, I guess. But I'm like, please, can I just come back midway or something? And she's like, adamant, like, no. So 7 weeks, I had no symptoms. I felt great. And I was excited. And it makes sense. If I had a suture, if it opened, yes, that made sense to have those symptoms. I had no symptoms. I made it to the 20-week appointment, and the ultrasound the ultrasound tech who always did my ultrasound just abruptly left the room. And I immediately regretted not just showing up to the office one day.
In the middle there, just having...
Wow.
Uh-huh.
I knew it. I knew it. And she walked in and she said, your cerclage failed and your cervix is open and the baby is right there. I said, oh, you promised me that I would have symptoms and that I would know. You told me that it was okay to wait 7 weeks and I asked you to come sooner.
And you're a nurse. You have the knowledge. And so you're like, I know that I can trust my body to present with symptoms if the doctor's telling me that this is what's going to happen.
Right. And I'm hypervigilant. So I'm like, we have to do something. I'm 20 weeks. This is as long as I've been pregnant. I have to do something. Can you redo the cerclage? She's like, no. Can I be put on bed rest? Can you monitor me? Can something? She's like, no, you can go and have the baby. That was the worst experience that I ever had with a doctor in my life. That casually.
Like, I get this is every day for you. Wow. That's like unacceptable. You deserved so much better.
Yeah. You were 20 weeks.
Mm-hmm. I was 20 weeks. Just needed to make it a couple more weeks. They had the NICU capability for those So I'm like...
Right. You're like, I'm in Atlanta.
Right. I'm in Atlanta, in the city. In the city. I'm not just, in rural Georgia.
Right.
So you mean to tell me we can't do anything? So I left that office angry. And I told her, I'm not going to deliver my baby. I am going home and I'm going to figure this out with or without you.
Because at this point, I'm assuming the baby has a heartbeat.
Yeah, at 20 weeks, yes.
Yeah, like it's not like the cerclage failed and like you had lost the pregnancy.
As I'm arguing with her, I feel him kicking. Like, How can I just go and be like, oh, I'm going to just deliver, you know?
Because you know that at 20 weeks.
Yeah.
Right.
And I asked her, I was like, wouldn't the baby die? And she's like, yes, at 20 weeks, yes.
Okay, then no, I'm not going to do that.
Then turn me upside down and let's I would be like, what can we do? I'd be thinking about things that are not science, right? Like
Right. I'm thinking I'll just get on the bedpan. I don't ever have to use the bathroom again. Like, I don't ever have to walk again.
Right.
Put the STDs on. I would be on an anticoagulant so I won't get a blood clot. I'm thinking of all these things. I'm like, I went into super nurse mode. So I left that office like, I haven't been angry in my life. I mean, tears streaming down my eyes. I'm just walking to the car, just angry. So I had to settle myself. It took me a couple hours because I needed to move fast. The baby was right there, you know. So I called everybody I knew, all my coworkers, every nurse, every doctor, every healthcare professional I knew or met at some point in my life. I almost called my pediatrician that gave, you know.
Like that swabbed your throat when you had strep as a child, right? Yeah.
Hi, it's me, Rachell. You may remember me from cold and flu season 1995.
Right.
Let's brainstorm.
Right. I need you now. So all my friends, everybody, my family, everybody. And I said, this is what happened. We need to find a doctor. And I had done research. We need to find a doctor who can put a trans-abdominal cerclage above my vaginal cerclage because it failed.
Mm-hmm. Right.
It's not that many of them. We need to find them. One that's willing to do it. Look all over the United States. I don't care. Preferably in Georgia. Preferably within the next couple of days.
Yeah.
Everybody went on the search. And we found this doctor. And I'm going to say his name because I'm about to speak very highly of him. Dr. Fogwell at Texas Health. I called him, his office, and he called me on his cell phone. We had a long talk. And he said, this is very risky. I said, what's risky? It's me doing nothing and staying in Atlanta under the doctor's care that I was already under. And she's having me at 20 weeks to go and just give birth. He said, well, come to Dallas. Now, he was known for flying women out and doing surgeries like this. He saved a 20-week twin pregnancy with a failed cerclage. So I'm like, well, I had one baby. You know? So,
right.
Oh my gosh. I can't stop crying. Okay, I'm trying to be professional here. Okay.
I was like, we'll drive. I'll just lay in the bag. I'll make my husband drive.
Right. You're like, rent an RV. Let's roll.
Right.
Like
be in the queen bed in the back.
Right. He's like, no, I need you to fly. I said, oh my goodness, Dr. Fogwell, you need me to fly? What if I give birth on the plane and they have to emergency land this plane? Like, what am I supposed to do? And he said, we're going to have to trust it.
Wow.
Lay down every chance you get. Put your butt up every chance you get. Only walk when you have to.
Did you lay down in the aisle of that plane? I think I might have done it.
I could do it.
The stewardesses would have been like, this is against FAA regulation.
Right. Do you want me to give birth on this plane? And then I'm trying to hide my pregnancy and hide, and I'm in tears. It's just looking crazy. I'm just on American Airlines, like, you know.
The lady in 13A is really giving me the creeps right now.
Right, but I didn't do it well because the stewardess kept coming over and handing me tissue. I was like, thank you. No, thank you.
Yeah, thanks, ma'am.
I made it to Dallas.
Mm-hmm.
I made it to the wheelchair, made it to the hospital. I mean, everybody in the hospital knew I was coming. The security guard was right. You're Miss Dumas. You know, we have the bed ready. Like, they rolled me straight to the bed. Didn't even register me.
That's how you do it, friends, in the healthcare field.
Exactly. He had done it so much, like the hospital was in line. I've never seen anything like that.
Wow.
Then everybody came in and did whatever they had to do and checked me in and whatever. But he made sure primarily I and the baby was fine. So I went to surgery. He told my husband it'll be 3 hours, and it took 8 because the plane ride and everything really pulled that baby down. So he had to make sure he pushed it back before he could do the cerclage. But I woke up and I was surrounded by so many healthcare providers. And I'm just finding the seats like, am I still pregnant? Am I still pregnant? And everybody's like, we're still pregnant. The surgery worked. We're like yelling and excited. And we're like, man, I'm like so grateful. Like, I'm so glad I didn't listen to that lady and I fought for this baby. Like, I would feel like a horrible mother if I didn't. Like, I fought for my child. Like, I am a mom. That's the moment. Like, I am a mom. I don't care what happens after this. Like, this is what mothers do.
Yes.
the anesthesia wore off, and then contractions set in. And they gave me every medicine, every Tocalid, every medicine to try to stop it. And they just, for 30 hours, I was in labor.
No. And at this point, you have the type of cerclage where you can, like, there's no exit there anymore.
I can't be in labor. And I was in labor for 30 hours, and then my water broke, and that was it.
No.
He had to roll me back to the OR, take out both cerclages, and I got an epidural, and I gave birth.
Vaginally,
and I held that baby for a few hours. Yeah. So when we talk about that perinatal mental health, at that point, that was my lowest.
Yeah. Can I ask a question?
Yeah, absolutely.
Okay. So I wonder if, like, this particular doctor, because this is like his area of expertise, knew to handle the labor that way.
Mm-hmm.
I can think of friends who, you know, like had a baby that was like stuck in the birth canal, and they like had to be put under to deliver. But if you had been put under, you would have missed you would have missed the whole thing.
Yeah. I would have missed it. I didn't want to miss it. I had to I'm sorry.
It's okay. I mean, welcome to the party. I'm just over here like trying to not distract from you telling this very important story, and I'm just like,
yeah. It's like fight through the ocean of tears.
Right.
This is the first time I cried with my story. This is the first time.
Not every doctor would have had the foresight to make sure that you were awake.
Yeah. Can you give another shout out, Rachell? Can you remind us what's his name?
I praise Dr. Falwell to the high heavens. He's at Texas Presbyterian in Dallas. He is a godsend of a doctor. I have no words for how grateful I am to him. He, during that time, was at my bedside 3 a.m., 1 p.m., 2 p.m., anytime. He was like, text me. He would text me first. How's everything going? What's going on? You know, talk to me. He was always there. I even asked him, at what point do you sleep? Because I'm in labor, and, you know, at some point you might have to go to the OR. I need you to...
Like, you're napping, right? I'm going to need you to be on point.
What's happening, sir?
Right. Why are you up? The whole time I'm up. How are we both in labor together? Like, you know, but that's the type of doctor he is. And if you ask anybody who's seen him, they all have, I don't care how bad the situation is. And my situation is one of the worst.
Right.
We are praising this man throughout this horrible, life-changing, traumatic event.
Yes.
That's who he is. So I gave birth, I held my baby, and he said, you know what, we talked about this. I hate this, but I already promised you, I'm bringing you back. We're doing a surgery. You're not paying for anything. And you're going to have your baby. And he wasn't the first doctor to tell me that I was going to have a baby. I didn't believe none of them. But when he said it, I was like, oh, I'm going to have a baby.
Newsflash, this just in. Just
in the middle of me holding my child who has passed, I'm like, oh, well, I'm going to have a baby, you know. In the pits of my depression and PTSD and anxiety, which I was later diagnosed with, I believed, because he said that I was going to have a baby. So I had some early miscarriages after that, but I went back that November, true to his word, he did that surgery.
So that was the abdominal.
And he said, with somebody who's had 5 losses, never would I want to have to perform a surgery on you or a procedure at all. So you should have had a transabdominal cerclage. It should have never been vaginal. Not you. It just makes no sense for you. And he said, you shouldn't have gotten to this amount of loss. It shouldn't have. And to hear that is so depressing. That shoulda, coulda, woulda. You know, as a nurse, one of the biggest duties that we have is to advocate for our patients. And I felt so bad because I couldn't even advocate for myself because of ignorance, literally by definition, a lack of education.
Right.
Yeah. And that is just a hard pill to swallow, that I shouldn't have, or I couldn't have been telling this story.
Yep. You didn't know. But thank goodness for Dr. Falwell.
Yeah.
Giving you some hope.
Giving me hope. And not only that, action. It wasn't just hope, right?
Yeah.
He then did the surgery outside of pregnancy.
Yeah.
During that time, too, I started therapy. And I had given up. And I started hypnotherapy.
Oh.
And that restored, it renewed my energy and my confidence in trying again. Because once he did that surgery, that was literally the last option. So I felt like I had to try, but I couldn't bring myself to do it because of the losses.
Yeah.
I did hypnotherapy, and she planted these seeds to make me confident again to move forward and try one more time. And in May of 2022, I got a positive pregnancy test. This time I started with the reproductive endocrinologist. I started the progesterone suppositories and the aspirin. I made it to 13 weeks. I graduated to the maternal fetal specialist doctor. A new one. A new one.
Uh-huh. Did you say, I need to request somebody different?
I should never see her again.
Good. Yeah, I mean.
And I never did. And I was still in the office where she worked, and I never saw her. I don't know if they knew I was coming and and she wasn't even walking in the hall. I would see every other doctor.
Yeah.
I graduated to the new maternal fetal medicine specialist, and I made it to my third trimester. And then on December 30th, 2022, I gave birth to a 4-pound, 15-ounce baby boy. And he was the most perfect thing I've ever seen.
How many weeks were you?
I was 36 weeks and a few days.
High five. Good job. That's some hard growing.
Oh my goodness. Were you in disbelief?
Oh, yes. I mean, before we went so I had to get a C-section because I had the transabdominal cerclage.
Okay.
When we were rolling back, I'm joking with the anesthesiologist, if you tell me a alien came out, I would believe that before you tell me it's a baby.
Mm-hmm.
So that whole pregnancy, I knew I was pregnant, but I didn't internalize it. I was just going through the motions.
You were protecting yourself. I mean, really. Yeah.
I was.
I think sometimes we feel bad when we're, let's say, disassociated like that. But I kind of want to honor that, that was what your brain, your heart, your soul needed to do to get you to that 36 weeks.
Absolutely. We're talking about survival mode.
Yes.
We're surviving. So, yes, like you're saying, honor that. To work through disassociation is a hard feat, but you have to do what you have to do. You have to compartmentalize. You have to do whatever you have to do to survive. And it's not just your life. You have another life or multiple lives.
Exactly.
But I made it.
Okay, so now you've got a tiny human.
I do.
That you are responsible for feeding, changing diapers.
But first, though, before you get home, is there a NICU stay involved?
It is.
Good question.
Thank you.
Because we had to deliver early. So at the last trimester, I started to have breathing issues and cardiac issues.
Oh.
That's a whole nother story in itself. Because of this, I had to deliver early. Me and the maternal fetal medicine specialist was like, yes, and when I delivered, all of my symptoms stopped. So I was diagnosed with POTS during my pregnancy, and my heart rate would be 180s. My oxygen saturation would dip to the 80s. Normal oxygen saturation is 95 to 100. And anytime I was sitting up or standing up, I could not breathe. So I was literally laying down the last 2 months of my pregnancy.
So you're saying you had POTS, what is that? Position, it's the position your body is in based hypertension, right?
Tachycardia. The oxygen is not being delivered to the lungs and different body parts efficiently enough so that you can breathe and that your heart rate can be normal. So yes, and it happens when you're up. So when you're laying down, you feel great. But as soon as you sit up or stand up, you are horrible.
And for some people, they can get dizzy, right?
I got dizzy.
You got dizzy too. Okay.
It was bad. It was bad. So I had to deliver. I got steroid injections to help mature the baby's lungs. But he still needed a little assistance. So he went to the NICU maybe 5 minutes after I held him. I'm like, did I really have a baby? Because I don't even see him.
Yeah.
He's not even here.
And it's not like you're able to just like hop up and go down to the, like, because you're recovering from all the symptoms that you've been experiencing plus a C-section.
Right. Plus giving birth. But miraculously, like when I gave birth, I had all the energy. If my legs were numb, I would have went to the NICU. Like literally, if I could like move.
Hang on. I'm just going to go to the, I'm going to go check on my baby real quick.
Right. That was me. And the nurse was like so tired of me.
Rachell, you can't get up.
Ma'am, sit, please.
Stop trying to get out of bed.
I know I'm a nurse, but
You were like your own worst nightmare as a patient. We have an escape artist in room 7A. Right. Keep your eyes peeled. Head on the swivel.
Right? They put me as a flight risk.
Yeah.
They're like, how you a flight risk when your legs are numb? Like, where are you going?
You're like, you guys know where I'm going, NICU or bust. Like, duh.
I'm trying to figure out if I really gave birth or not. Like, we need to figure this out. Like,
yeah.
You know, there's no baby here. You keep saying, like, I give birth. I have to see.
So you had to wait 12 hours?
12 hours.
Oh, no.
That's such a long time.
And then are you, tell us what happened. Like, are you wheeled then to the NICU?
Yeah. And I'm like, it's moving my whole body to try to wake my legs up, like, as soon as possible. I'm like, I really can walk. I can walk.
Yeah, let's go.
I'm like clapping my legs.
Like, I know these things work. Come on.
Right. But I'm like, I could walk. She's like, please stand in the chair. I'm like, okay. I'm like,
you're like, hurry up. Push faster.
Right. Why are you going so slow? Like, run with the wheelchair. Like, we got somewhere to be.
Yeah.
You know, forget those fluids. I don't need that.
Who needs to be hydrated?
Right. I'm in a wheelchair. It's not like I'm exerting any water, energy to produce sweat. So I get there, like, man, this tiny little baby. And I'm at first like, is this my, like, is this the one?
Are we together? Or
she laughed. She's like, yes, that's your baby.
I'm just asking. Jeez.
Right, I gotta verify,
Yeah.
And I was like, man, he doesn't look like either one of us. So he has like all these cords and wires and stuff. It's like,
my family doesn't have cords and wires attached. No resemblance. I'm not sure. So you get to see your baby.
Yes.
Like a little skin to skin, or?
Yeah, I was able to. Oh. I started pumping during my time in the while I was waiting on him in those 12 hours. I was like, I gotta do something. I pump, get some milk out or something. So I was working on that, and I was able to muster up like maybe like a drop. I was so excited. I was like, look at me, I'm a cow. Oh my god!
Check out this colostrum.
I got the little colostrum. I got the liquid. Oh.
Yep.
I was so excited to be a cow, and like, I was so excited. My best friend like changed my ringtone to like Doja Cat's "She's a Cow." Like, I was so excited.
You're like, yes, I am. Yes, I am.
I'm like showing people, like, I got the little syringes, so I brought it, and he was able to like put it in his mouth and stuff like that. And I held him, and he was just so perfect, and it was so scary to hold him. Like, I'm used to adult-sized people with all these tubes. To see it, baby, it's just like, oh my god, like, I don't want to mess up anything. Like, I know how to put it back, but still, like, I don't want to be the one that's, remove it. So, but even then, I didn't feel that bonding. I didn't feel it the whole pregnancy. I didn't feel it immediately when I heard him cry like everybody would say I would. I didn't feel it when I held him in the NICU. And while I was happy he was okay, I started to feel guilty. It started to creep in because I didn't feel that bond.
Like, you were expecting to have a certain type of emotional response that you weren't having, right?
So I only expected it, Emily, because people kept telling me that I would.
Yeah.
They kept asking me, they kept telling me, and I'm waiting on it. I'm like, what does this mean if it doesn't happen?
Yeah, what does this say about me?
Right. And I'm like, man, is this the right baby? Because, like, should I be, like, is that, a thing? Or, like, okay, this is my baby for sure. So I still don't feel it. How long does it take to come in? And that lasted, honestly, a month. I didn't have that bond. I just was waiting, and I'm going through therapy during this whole time, and I waited so long to finally accept that he wasn't going anywhere. I was waiting on him to leave me.
That is understandable after there were so many losses.
Yeah. So I was waiting on him to leave, and I kept telling my therapist, I'm doing everything for him, right? But it wasn't like a mom-son relationship. It was a nurse-patient relationship. Like I would care for my patients. And, I'm a very compassionate nurse. Anything they need, I'm doing it. I'm advocating. So he didn't miss anything, and I would hold him and, everything, but it just wasn't there.
What was it like? What was it like when it changed?
It was a slow progression.
Uh-huh.
It wasn't a day where it just clicked, right? It was just like I had to work to allow myself to accept that I'm his mom and he's not going anywhere. He's here. I had to get comfortable with understanding that and believing that. I had to believe it. And that took a while, but it really started at a month. And once I got there, I would say at 3 months, I was like, this is my son.
Oh.
I started showing ownership and saying, okay, this is my baby, my son, saying his name. Because it was the baby for the longest time. Yeah, the baby is in the room. The baby is in his bassinet.
That resonates with me. Like, I had a very similar, did not use the baby's name. Yeah.
Yeah. Mm-hmm. It's hard. I didn't even realize I was doing it. My therapist pointed it out. I didn't even realize it.
You were sitting down and your therapist said, Rachell, did you notice you haven't even used this child's name?
She kept asking, you're a baby? I'm like, yeah, I guess, we don't have to keep talking about it.
Don't make it weird.
Like, you're making me uncomfortable.
She making it weird? Anyway. Wow.
Yeah.
So you had the baby, and the baby, we saw a little snippet. Well, you put your phone up. For anybody listening, Rachell, a while ago, she held her phone up. Oh, we're seeing a picture. Oh, so cute. Rachell, how old is this baby now? Maybe not so much of a baby anymore. I don't know.
On the 30th of this month, he will be 2. So he is an almost 2-year-old pot-bellied toddler.
An almost 2-year-old pot-bellied toddler?
Yes. Who runs around giving me commands.
Oh.
Barely speaking English, so, so much authority.
Sir, I don't understand what you are commanding of me.
Right. But I'm doing great. Honestly, once I got over that bonding hurdle and I just was pregnant for a while, and it felt amazing. I literally did. People would ask me, how's motherhood? And I would say, this is easy. And I meant it.
Compared to what you had been through?
Yeah, compared.
Right? Yes.
I just said it in general because it felt easy to me in general. And it was compared to what I've been through. And I think people was just like, man, you've been through just the worst that you think motherhood is easy.
Mm-hmm. Like, you're sleep deprived actively, and you're saying this is a piece of cake.
This is wonderful. And I meant that. I really did. I meant that motherhood was easy for me. I was taking the baby out on strolls and stuff. Anywhere I went, he would go, and I was just living my life. I went to Mexico when he was 6 months, and he was in a hot tub. This is a piece of cake. I was so serious. I was like, this is easy. We're traveling. Like, we went to New Orleans, This year we went to Mardi Gras. This is easy. And that's how bad the journey was, that I'm like, yeah, motherhood is a piece of cake. This is nothing.
Yeah.
2 years old, world traveler. Sorry. No wonder he's telling you what to do, Rachell. He's like, I haven't had a hot tub in Mexico in a year and a half.
Right. He has his passport and everything. Right.
It's been 18 months since my last time in Mexico.
Right. When are we going? Can we at least go to the Bahamas? Something close.
Come on.
Right. Goodness. He went to San Diego for his first birthday, and that was just amazing. So much fun. It was really funny, but
I mean, it's okay. We won't tell him.
The zoo, just go check it out if you haven't. It's just impeccable.
Oh, in San Diego?
Yes. Yes. And a safari.
Oh, hot tips. Rachell, before we get into a really fun lightning round, I wanted to ask you about what you're doing now to support folks in the perinatal period. Spoiler alert, I already know. It's really cool. Can you tell our listeners about the nonprofit that you founded?
So I took a year and a half of rest. That is crazy to say because what is resting with a newborn? Anyways.
She was air quotes resting.
And by resting, we mean wrangling a baby/toddler.
I'm pregnant for a year and a half. That's what I want. To clear my mind. Whatever that looks like with a baby.
And to heal. I mean, you were doing therapy. Like, you were doing a lot of, like, internal work on yourself.
Your body had been through a lot. Your head, your heart, everything you had been through a lot in many different ways. So you gave yourself time.
Yeah, I was doing a lot of work and I was trying to get back to myself. I was trying to figure out who the new me was.
Ah, did you hear that correction? I just want to point that out, if that's okay. I think a lot of parents think, I need to get back to myself. And you acknowledging and correcting yourself there, thinking, no, hang on, wait. I needed to get to know who I am now.
Yes.
We all have to do that. And it takes us all different periods of time to like realize that. For me, it was the same. I was like, who am I?
Yes.
I had that same thought. So you gave yourself the gift of time to get to know yourself.
In different ways, right? Who are we as the career person, as the mom, with this new role, as the friend, as the wife? It's so many dynamics. Who am I in relationship to all these different people that's been there this whole time? And now this new person that I'm trying to get to know too, because he's a stranger, essentially.
Right.
We don't know each other.
He came to your house and he's telling you what to do.
Right? I don't even know this guy.
Sir? I don't know who you think you are.
And we don't even speak the same language, but I better get whatever he's saying.
No, he's only giving me one syllable, maybe two.
And then you're in trouble when you don't understand, right?
Right. So I took a year of rest.
She also was learning a new language. Gibberish.
Right. So I took a sabbatical from pregnancy and in the midst of rediscovery, I was like, I don't want anybody else to go through what I just went through. This was horrible. Maternal health disparities, mental health issues throughout every level of pregnancy and thereafter.
Yes.
Just so much. So I started a company called A Light After 9, and I named it that because my baby was my light after 9 losses. The other light is that I survived it, and I was on the other side after 9 losses. So I felt that the title would be appropriate, the name would be appropriate. So we help moms, birthers, villages with all resources as much as possible throughout their pregnancy journey, especially the difficult ones. So whether that's finding maternal or mental health or maternal mental health resources, therapists, counselors, hypnotherapists, or whatever they need.
Or doctors like Dr. Falwell.
We do doctor referrals and find specialists, and we vet them for you, make sure they're high quality. We also make sure we give grants because this is expensive. I'm still paying hospital bills from these losses.
Yeah.
It's expensive, and there are a lot of grants out there that I didn't know about when I was pregnant. But I make sure others know about these grants, and we refer them to other organizations like PSI, March of Dimes, who are helpful and pivotal in the pregnancy journey and thereafter as well. On the other side, on the corporate side, we are getting at the bedside to help with maternal fetal palliative care. And while some people think of palliative care as end-of-life care, there's this component of comfort. So making sure your pain is managed and your nausea and you're being heard and advocated for when you can't do it yourself. When you are unable to because you're going through whatever issue with pregnancy and you need somebody to step in, that's what we do. We make sure we speak up on your behalf. And then we do case management after, because once you leave the hospital, a case manager does not follow you. You need that help throughout pregnancy. And then I would argue 6 months to a year after you give birth. we're hopefully going to start a really big contract soon. Fingers crossed.
Our fingers are crossed for you. My toes are crossed too.
Please cross your toes. So we can start this initiative at our pilot hospital chain soon.
Yes. Let's clap. Let's clap for it. Yay! I saw those hands come together. We're clapping too. That is so incredible. Such a gift to families that need the help that you needed. So, yay, that's incredible. We will put a link to A Light After 9 in our show notes so folks can check that out. That's incredible. Oh,
thank you.
I'm going to ask a question that I know the answer to, but I think it's important for you to say it. I wonder, do you help parents with all types of pregnancy complications? Because yours was specific related to your cervix, but obviously like people lose pregnancies for many, many different reasons, right?
Absolutely. So we help anybody with any pregnancy. You can have a cookie cutter, smooth pregnancy. You can go to a few OB appointments, get an ultrasound here and there, and just go and deliver it. But that doesn't mean it's going to be an easy pregnancy for you. So if you need those resources, please reach out. It's mentally and physically taxing. And then if you have difficulties, any of those, when we go through these difficult pregnancies, we need specialists, we need unique support and unique plans of care. So we make sure that we partner with you to make sure you're comfortable with the plan of care as possible moving forward, and that you know what's going on, and you know what those labs mean, and you know what the doctor said at the appointment, and you know when to follow up and who to follow up with. All of that.
Right.
well, that's really incredible.
So cool.
Thank you.
You're like, I see a need because I lived it.
Mm-hmm.
Yeah.
And you happen to like have training that was, I mean, trauma nurse is not, like you said, it's not perinatal, it's not mental health, but you had already training and understanding that like really like you were destined to make a big difference like this, I think.
Thank you. Yeah, it's a unique and it's very innovative, the service that I'm going to be adding to the hospital. I'm also working with the Association of Hospice and Palliative Care too, to make this change, because there were so many times I was in a hospital and I was going to be experiencing a loss. It was imminent sometimes. I needed palliative care. I needed advocacy. I needed somebody to be there when I couldn't.
Mm-hmm.
And somebody who knew about maternal care, so we need that specialty, and it's going to be a big change, but it's needed.
Did you find that like when you knew that the loss was imminent, that you were experiencing like physical symptoms that weren't being treated? Is that sort of part of it? I mean, obviously they were not careful with your mental and emotional health.
Right.
But did you also feel like you were like, I'm experiencing pain or I'm experiencing nausea or some other symptom that like they weren't even treating your physical body?
Yeah. So there were pregnancies where I was in severe pain and it was just overlooked because the ultrasound looked normal. There were times where I would report certain symptoms and because the blood work looked fine or my vital signs were fine, they said I was fine. The baby has a heartbeat, everything is okay. It's so many other things that we need to evaluate, and we need to look at patients as a whole so we treat them correctly, or else we end up with situations like mine, loss after loss after loss.
Yes. The fact that you made it through all the things that you made it through and like have decided to make meaning out of it, I think is like, it just speaks to like who you are.
Thank you.
Yeah, thank you for sharing all of that with us. Have you told your story many times? This is not an official interview question. Look at me. Look at me. I'm off the cuff. Usually I stick to all the questions. I know. Look at me go.
I have. I told my story. I actually finally reached out to the hospital in Texas where Dr. Fogwell is, and I sent them an email just saying, basically, give this man a raise. He needs to make at least $5 million a year, and honor this man every day. So I told him my story, and they asked to have a meeting. And last week we had a meeting, and They're like, we want to feature you as a premiere story for our hospital. And I want you to come to Texas and tell all of the staff, the doctors, everybody, the execs about this. And I said, I'm only doing that if we honor Dr. Falwell that day.
Mm-hmm. Yeah.
And they're like, absolutely. So, yeah, I have told. And
that's the power of negotiation. Nice work.
Way to go. Next time I need to negotiate something, I am calling in Rachell and
yes, and
her assistant, who is really demanding, apparently.
Right. I feel like Olivia Pope, like, oh, okay. And I need this.
And here's what else.
Right. Here's how this is going to go.
Right. They're like, absolutely, absolutely.
Mm-hmm, mm-hmm. Oh, I have a question. You've shared your whole story. Is there anything that, like, because you've talked about how your organization helps both the person giving birth and the village that supports them, like what are the most noteworthy things for supporters? Like, what's your advice for like the village, for the partner, or for whoever else is there, like either in the room or like at home, thinking and hoping and praying that everything's going to be okay? Like, what do they need to know? Right.
So the role of the partner, you're in closest proximity than anybody else. It is a very difficult role because you're dealing with your emotions, the birther's emotions,
yes,
all of the doctor's visits, or whichever one you choose to come to, or whatever the case may be. You know, you're trying to prep for a baby, a whole new life. This is going to change your life. But you also know that you're not technically the star of the show either.
Sorry, partners.
Take note.
You know, you're not giving birth. You know, you're not risking your life to bring life into the world right now. You're not the star of the show. However, you are the most important supporting role. And you have to be on your A game even when you don't have it in you. Because literally your partner is risking their life to bring in your child's life. So they need the support. So the first thing I want to say is just address your mental health.
Take care of yourself so you can help take care of your partner.
It is the same principle of when we're on a plane and you have to put your oxygen mask on first, because you can't do anything if your mental health, your physical health is not where it should be. You have to be there.
I mean, that includes drinking water and sleeping, right? Like,
yes. But then ask your birther, your partner, what they need. Ask them what they need. Sometimes it's a simple question. What do you need right now? Because no, you can't read our mind. Mm-hmm. No, you can't always anticipate a need. Yes, we're too tired to always tell you, but at least ask the question just to see. Because sometimes we anticipate wrong and you can make the situation worse.
Oh, yeah. You know what happens when you assume.
Yeah.
Yes.
Yeah. And then also be open. Be open too, because there was a period, a very long period after I gave birth where I just couldn't be touched. And I need you to understand why I can't be touched right now. And not have an attitude or be upset with me because I'm overwhelmed and I've been touched out, because I've been touched by a baby 24/7 since I, got him from the NICU.
Yep.
This is a very very common.
Very common.
Yes.
I know all of us here in the podcast studio felt overtouched for a long time.
Long time.
You got that baby on you all day. Just to have a little bit of a break from that.
Yes. Mm-hmm. Even if it's 5 minutes and I'm putting the baby down, I don't need you to come right behind and touch me, and I need you to be okay with that, because if you're making me feel guilty, then I have something else, another space in my mind.
I think it's also about need, right? Like you are hyper aware of the babies, infant and toddler, whatever the situation for someone, like that person who's just given birth or the person who's the primary parent at home is attuned to need.
Yes.
And so to have the non-birthing partner needing to center their own need, yes, there's a time and a place. Yes, that birthing partner has needs. And yes, those needs are important. But it cannot become another thing that the person who's at home recovering.
It's another to do.
Don't add another thing. Yes.
Yeah, don't add that other thing.
It sounds terrible. I mean, it sounded terrible to me at the time. I was like, I remember thinking like, oh, I feel so bad. But the most important thing, I mean, I don't know, I could, just in my opinion, I think is just at least having this conversation with the partner, right? And saying, I don't not like you. I
don't like anybody.
I don't like a single person right now. No, I'm just kidding. But just letting them know that this is why. It's not because you've done anything wrong. It's not because I'm revolted by you. I need a break. And I hear that this is what you need. And, you can find a way to come up with a solution, but I think understanding each other is really important.
But that comes to open dialogue.
Yep.
Understanding, grace and patience. Because I am a firm believer, if mom is taken care of, baby will always be fine. So take care of the birther.
Yes.
Prioritize that. And she has to be selfish, and allow her to be selfish and be selfless. Be selfless and be understanding, and know there are hormonal changes. Know there are things going on that you don't even see. Things that she has to do to make sure the household and the baby and everything is going accordingly that you don't even see. The invisible mental load that she has.
Yes. I think the dads and the non-birthing partners that we've interviewed would agree with this. Like, I think that they would say, yes, like, I was focused on trying to help my partner. And then once my partner started to feel better, there became very organically room for me and my needs as well.
Right.
And there was.
Right.
Yeah.
Most of the time. And I think when we think about babies, we worry about sleep deprived and all of that. But that is such a big component of bringing a life into the world, is how to have your relationships, and with an S, I'm talking about friendships too.
Oh, yeah.
All of them. How do those relationships survive this period, especially that initial period? Because you have to be selfish. And if you're not selfish as a birther, you're going to suffer. So you have to be selfish, and then everybody else has to be fine with it.
Yes.
Yep.
To a certain extent.
That's a tough one to be okay with. It's uncomfortable to say, this is what I need, and I'm going to trust everybody else to handle their feelings about me telling you what I need. But sorry, not sorry. I've got to just be taking care of me right now. Love you, care about you, but really need to focus on me right now.
Right.
Mm-hmm.
But then, Danny, we can't even say that sometimes. And not because we don't always feel comfortable, because sometimes we just don't feel comfortable saying that, but because we can't. We're so boggled down that we can't even vocalize that, because there are no words left because we're too tired.
Yeah.
Like, sometimes you just need to just give grace and just be like, she is not somebody I want to be around right now. But I know what she's been through. It's okay, though.
Yep.
Just push some food under the door and walk away slowly. It's going to be fine.
With the broom, too.
Don't make eye contact.
Right, right. Don't let me see you. Just push it around the corner.
Yes.
It's so real, though.
Mm-hmm.
It is.
That's the real part of it. And, we go through it. We survive it, and then we thrive.
Well, it's really lovely seeing the surviving and the thriving after the story that you shared with us. And thank you. Thanks for being here and for sharing all of that with us. This podcast is not over yet. We still have a quick lightning round to hurry up and get through. If you are willing.
I am.
Okay. Then let's get into it. Rachell, besides this podcast, what's your favorite podcast if you'd like to recommend one to our listeners?
I don't think there is another podcast.
Well, hang on. I'm sorry, what? Just this one?
Once more for the people in the back, please.
Is there another podcast? I'm going to get killed for saying that.
For all the other podcasts that Rachell's been on, earmuffs.
I love all of you so much. I am not about to get in trouble. I refuse to answer that question.
I heard Rachell loves us.
Yeah, I heard we're the favorite.
I love all of you guys.
Okay, Emily, next question. Got that answer. Check.
Okay. We've gotten some great recommendations. Like, I've listened to some really good books and podcasts and watched some real good TV. This next question, I love it. Are you currently binge watching or reading anything real good that we need to like put on our list?
So can you believe I don't watch TV like at all?
I can. You're not the first person to say.
Really? Okay.
Yep, that's okay.
I at most might turn it on and like I'm on my computer working all the time. But I definitely read. I am a reader.
Go on.
One of my favorite authors of all time, and she's going to be at this summit, this mom summit, Brene Brown.
Oh, God, yes.
Hey, Brene, call us.
All of her, I love them all. I love them all. Brave in the Wilderness, The Atlas of the Heart with the HBO special that she has.
Oh,
yes.
The series, if you haven't seen it.
Not yet.
If you hear, I'm going to write you a letter because you helped me survive my pregnancy. I'm just going to put that out there.
You should write to her.
I am. I'm going to write to her.
I mean, she's also in Texas.
She is in Texas. I'm like,
you're about to be
She
there.
needs to know about, yeah.
She needs to know about this. Brene, please watch this podcast. First of all, you should already be watching because why wouldn't you?
Dear Brene, have we got a lunch?
Yeah, you want to have lunch with Rachell? You should.
Just know I would never be stable again. I don't know if I'm stable now, but I would just be extra unstable. I'd be extra unstable. Just considering who I'm meeting, that's kind of insane to say that. Just considering.
Mm-hmm.
But I would. I love her. I do.
She's lovely. I've never met her.
She sounds lovely in her audiobooks.
Brene, you don't know us, but you will.
Right.
We're going to get like a cease and desist letter from
Right.
attorney.
Don't make it weird.
And this was the last episode of the I Am One podcast.
Right.
I'm just kidding.
It went out with a bang.
Yeah. Rachell, do you have an awesome parenting hack that you'd like to share with our listeners? Oh, giggles.
Okay, I'm listening.
No, I just I don't. That baby runs me. I don't have a parent.
Hold on for dear life. Is that
Did you not hear me say I'm trying to learn? I'm trying to learn a new language so he could stop fussing at me as much. I don't have a parent.
Okay, so maybe we need to let's ask the audience, who has a great parenting hack for Rachell? Right. She's accepting comments. Put it in the notes.
Yeah, if you've got like an 18-month-old to a 3-year-old, you throw just tell us.
Or a 56-year-old baby. Like,
yeah.
You know.
The comment box is open for Rachell. Rachell, if our listeners drop some knowledge, you're going to be the first one that we will share that with.
You know, let me say this, though. My pregnancy journey was horrible. I mean, we could agree on that. That's probably an understatement. But my baby is the easiest going baby. I literally don't feel like I even need a hack. Like, he sleeps 10 hours a night.
Okay, that's quite enough. I'm just kidding.
Like, literally, if you feed him, he does not care. He, like, doesn't care what's going on, right?
That's not fair. It is fair. You've been through enough. You deserve a unicorn baby.
Right, he is. Right now, he sleep right now through the podcast. It's like he timed it. Like, oh, Mom, I know.
You're going to need some time to yourself. Let me just go ahead and sleep.
He gets it.
He gets it. I couldn't have asked for a better baby, even if he wasn't like that. But he is, like, I know after that pregnancy journey, maybe, the universe, God, it's like, you can at least get, an easy baby. So.
Well, scratch that. Rachell doesn't need any parenting hacks, but Emily and I do.
She's got this. We
have teenagers. If anybody would like to drop parenting hacks in the comments for teenagers, we're also accepting things in the advice in the comment box. Yeah. Anyway, but Rachell, that's a story for another day. Emily, are you ready to ask the next very lightning-y question?
I was thinking about changing the question. Very, very me.
Oh, okay. Go for it.
Okay. This question used to be about radical love, and I would like to ask, what is your secret indulgence?
Oh.
This could be food. This could be like life, anything. Tell me a secret indulgence.
I have two. One, I feel like it's a obvious one, just travel. Like, I have to travel. I just went to Bali this year, and it just, I almost died coming back, but nevertheless, I still had an amazing time.
Wait a second. Okay, that's an interesting thing just to drop in the, anyway, and the second thing I like to indulge in, hang on, what? But, okay.
I did. I was in the hospital. Like, I was reaching for the light. It got really bad.
Sick?
Yeah. Like, literally.
Okay, spoiler alert, Rachel's fine.
Yeah, I'm here. But the second one, it might seem very small. Once the baby goes down at 8:30 sharp every day, I love taking a bubble bath.
Oh.
I do. It's the most relaxing, and I have to drink tea. I have one of those things in the tub where you could put like your laptop, all that stuff.
Oh, like a tray that goes across?
A tray. And I take a bubble bath with Dr. Till's, the melatonin one.
Yeah.
Oh,
Ooh.
they have hang on.
My mind is blown.
And chamomile tea with honey. And that is my indulgence, like my daily indulgence that I look forward to.
Chamomile tea with melatonin.
No. The Dr. Till's, the Epsom salt has melatonin.
It's in the bath water.
It's in the bath water.
Got it. Sorry.
Just like drug yourself with melatonin in your tea.
In a healthy dose that is recommended on the package, people. Okay.
Right. Read the instructions, everybody.
Yeah. But, oh, that sounds so relaxing.
It is. It is. The smell of the melatonin from the Epsom salt is so relaxing. And then the chamomile tea. And I play like some quiet music. And I look forward to that on a daily basis. I really do.
Yeah.
He's down. He goes to bed 8:30 sharp every night in his own crib.
And you're like, bubble bath time.
I could breathe. I can think my own thoughts. I could just do nothing. I can think about nothing.
Yes.
I love it.
What a treat to think about nothing. Yeah.
Cool.
My brain's a highway. Lots of overpasses, lots of traffic in there all the time. So to just kind of not have a lot going on feels like a treat. So
yeah.
Cool. Hey, Rachell, if people are interested in connecting with you, what's the best way to do that? Can they find you online, email you? Tell us.
So we try to make it as easy as possible. Pregnancy is already hard enough. I don't want you to have to think too much about how to connect. We do have intake forms on our website and all that. You can literally send me a DM saying help. And we'll figure the rest out later because it just be that bad sometimes or stressful. So we're on Instagram, A Light After 9, Threads, A Light After 9. I am on LinkedIn, Rachell Dumas. You can follow me, connect with me. I'm on TikTok, Dumas, RN. But you can go on our website too at alightafter9.org. So any way you do it, intake form, DM, call us, whatever you need, any type of way you need help, we would do our best to help you. We're here for you the way you want us to be here.
Awesome. We'll just drop all the links to all the platforms. So wherever people are frequenting, then they can just find you.
Yes. We welcome everybody, birthers and non-birthers. We're here for the village.
Mm-hmm.
Yeah. So important.
You know what? There's one really important question that we forgot to ask. Well, I mean, there are two.
Okay.
What is... What?
Go ahead. Sorry, my bad.
What? Okay. What is one thing that today you needed to hear, wishes you could go back in time and say to yourself? What would you say if you could hop in a time machine?
Girl, I'm just playing. I don't know what you think this is about to be. But I would say get therapy early. Even if you're going to do this and it is a smooth pregnancy, like I said, the changes that your relationships go through, you go through, just everything changes. And to have that additional support, even preconception, I feel like would have made this journey easier for me. I feel like I waited too long to start counseling again. I still started nonetheless, but I feel like if I could go back, I would have started preconception.
That's great advice.
Yeah.
We're big fans of therapy. Yeah.
Yep.
Yeah, it's hard though.
Yeah, it is.
That is pretty radical love, though, to do that. So, Emily, are you going to ask the other question?
What's the...
Oh, well, the other one, we also like to make sure that everybody's staying hydrated. So,
Oh, God, right. I totally forgot. Yeah. How do you take your water?
give us some hot tips.
Vitamin water person.
Vitamin water. Okay.
Sponsor us.
Sponsor us. I love dragon fruit specifically.
Oh, yeah.
That is my favorite hydration choice. It's the dragon fruit vitamin water. I love it.
Cool.
Yes.
Next episode's going to be like sponsored by Brene Brown.
And vitamin water.
Yes, vitamin. I think what? Coca-Cola, right? It's Coke.
Oh, maybe. I don't know.
Really? I mean,
Not sure.
you're like, now I'm reading the label. Hold on. Let me see what I can find out here.
Hey, Rachel, we're podcasting here. Oh, sorry.
Like, hold on.
Emily, would you like to take us out?
Yes. Okay. Rachel, your story was full of complicated pain, and it was an honor to hold space for that and to relive a little bit of that with you, because your telling of it is going to help other people. And hopefully everyone will know about transabdominal cerclage, literally first time today. So thank you for sharing your story with us.
Thank you so much. I appreciate that.
Thanks for tuning in to the I Am One podcast. Check out today's show notes where we'll drop links to all the important things that we mentioned in this episode. Please consider sharing about I Am One on social media and following and rating our show wherever it is that you listen to podcasts. It only takes a minute of your time and, well, that'll help our collective mission of bringing resources and local support to folks worldwide. From everyone here at PSI, thanks again for listening.